So one of the common misconceptions about autism is that it is a mental health condition, which it is absolutely not at all. But it can co-occur and commonly does co-occur. I think a higher number of autistic people experience mental health difficulties than in the allistic population. And at the same time, autistic people can also be misdiagnosed with mental health problems ahead of receiving their autism diagnosis. Emily, I know you've had a lot of experiences around this, so I'd love to hear more about your story.
Well, I think growing up autistic is hard. For, I think, most autistic people in this world, it's hard. And I think it can be hard whether you're diagnosed young or whether you're diagnosed older. But I was diagnosed when I was 16, so I kind of had like my childhood of not knowing that I was autistic. So I masked a lot, and that took up a lot of energy and eventually resulted in kind of anxiety, OCD, depression, and then I ended up being sectioned in a children's unit when I was 16. And I think it's just because the whole world was so overwhelming, and trying to navigate life and know what to do, what to say, what was expected of me, whilst managing kind of sensory overload all the time, difficulties with my emotions, relationships, when I didn't know that there was anything, I was going to say anything wrong with me, but it wasn't wrong, it was just different. And it wasn't, I guess, I didn't know I was experiencing the world differently to anyone else. And so when I got to 16, it just kind of all exploded. And that's how I ended up in a mental health crisis. And I think, unfortunately, for many autistic people, that happens, whether it's because they don't know they're autistic, whether it's because they're put into therapies like ABA from a young age that is really harmful, whether it's because they've not had the adjustments they need, whether they're kind of just not getting the right support or having difficulties in life with relationships and stuff. Often it ends up presenting in mental health issues. I think a lot of autistic people have these comorbidities, whether it's anxiety, depression, eating disorders, even things like bipolar, schizophrenia. So yeah, it can be really difficult for autistic people to kind of navigate those mental health issues as well as being autistic, whether they know they're autistic or not. And then I guess getting the right treatment for that as well. Often the treatments that are given for those illnesses we might need, because if we have that comorbidity, we might need that treatment, but that treatment isn't always adapted for us and the way our brain works. Sometimes we can't access it or engage with it properly. So it can feel like we're on kind of quite an unlevel playing field, really, because when we're given that treatment, we're expected to kind of engage with it fully, but actually they're not always meeting our needs in the way that we need them to.
Yeah, I agree. My story is that I was first involved with primary mental health services at about the age of 18, 19, and I went through a range of diagnoses, including cyclothymia, manic depression, EUPD. Basically, I had clinicians saying to me, we have no idea, even to the point that I had 3 admissions to mental health units, and I was kind of cracking jokes and masking and trying to fit in. And the doctors were like, we have literally no idea, because you're kind of cracking jokes and then you're really not fine. And then you're cracking jokes and we don't really know what to do. And so as a clinician, how do you kind of, when you work with someone who's got coexisting conditions, also maybe diagnoses that aren't relevant, how do you tease that apart from the autism and decide what the best approach is?
It's a very good question. A lot of the people I work with are assigned female at birth, and I would say 90% of them have come to me, having come through a myriad of other diagnoses before they've got to me. And what we don't talk about is then the PTSD that's diagnosed because of the trauma of being misdiagnosed, sent through the wrong services. It is tragic. It is so wrong. And anybody that has been in either of your positions, Ella and Emily, like that you've gone through so much that actually it's almost like you have to start again and you have to go back to the beginning and you have to understand what the function, the reason is behind the things that we're seeing in front of us. So you do have to understand where the autism plays a part or the ADHD plays a part, but you have to understand what came first in a way and what leads into the other. And I think that's the great difficulty. And if you only spend an hour with someone, you're not going to get that. So you need to get the story. You need to go back to the beginning, get the story, understanding, are they depressed because of having to mask? Are they anxious? I think we have to think outside the box and we have to think beyond what we're seeing in front of us and we have to ask the right questions and we have to listen.
I think that's really true. And I think you're absolutely right. It's not that we are saying that clinicians are getting it wrong. I think what we're saying is that clinicians aren't receiving enough ongoing training to make sure that everybody's up to date. So, for example, I was on a psychiatric ward, colour coding and labelling and organising the cupboards, writing my routine on a board and rocking in a corner, and I still had mental health professionals going, oh gosh, I couldn't possibly imagine what this might be. And not once in that entire 20-year period did anybody suggest autism. That was something that I came to myself after the diagnosis of my own child. So I think it's really important actually that we end up with more crossover between autism services and mental health services. And I think another challenge as an autistic person is because we have difficulties recognising our emotions and our sensory needs and what's going on in our bodies, recognising our mental health issues can also be a challenge. And Emily, you touched upon this when you talked about not necessarily even being able to identify your anxiety. Do either of you have any thoughts on what you would do now to notice that your mental health was starting to slip?
I think for me, although I struggle identifying my emotions, there are some quite obvious behaviours that I can recognise, or thoughts that I recognise, so thoughts of harming myself, just quite dark thoughts. When I start to experience those again, that basically tells me that my mental health is declining. Even if I can't recognise the emotions that I'm feeling, those are quite objective things that I can sense that I'm experiencing. So things like that, even things like when my OCD kind of obsessions kind of increase again, I can recognise that as well. Sometimes other people can tell me as well. They say, you seem a bit off today, you seem a bit snappy, are you okay? But I think it's those kind of objective measures which I kind of recognise in myself.
Yeah, that's really true. I know that when my mental health is struggling, I go to, I should stop doing YouTube as a living because I'm terrible at it and everyone hates me. No, hang on, I definitely don't normally think this. This is a sign, so it's a similar kind of thing. So in terms of like, as a clinician, presumably at some points you're advising people on how to look out for these kinds of signs. What kind of advice do you generally give?
Yeah, it's funny because in the last year I've been diagnosed with some mental health conditions, and I don't mind saying that because I think it would make me a hypocrite not to share that. So I think the irony is I was telling people to do things I didn't notice in myself, and in a sense it's giving me the opportunity to be on the other side and realise how hard it is to recognise it in yourself. So it would be things like, are you starting to withdraw and isolate from even the people you feel comfortable with? Are you cancelling things? Are you staying in bed? One of the things I did was self-medicate with very unhelpful ways of managing it. If you're noticing that go up and you're noticing it's at a harmful level, then something might not be right. I would always say that it's easier said than done, but surround yourself with the right allies, the right people, the right advocates for you as well, like whether that's partners, friends, people you trust. Because when they say you're not doing very well, you know they're telling the truth, because sometimes you have to be careful that it's not people just trying to make you feel bad. Doing what makes you feel better, whether that is stimming, whether that is surrounding yourself with your sensory, seeking affirmation places, and seek help if you can. And even if that means writing a letter to somebody rather than vocalising it, I always encourage people to write or audio into their phone to ask for help.
Yeah, that's really useful. And I think, like, kind of on the other side of that, there's that also tendency to have one bad day and think, when you've experienced mental health problems in the past, oh gosh, that means I'm going down again. So it's like a balancing act, isn't it, of being aware but not so aware that you're kind of derailing yourself, which moves me on to what kind of strategies do you use as an autistic person to support your mental health, either in crisis or just on a day-to-day basis to keep yourself steady?
Yeah, so I'm still on medication. So the first thing I would say is to seek professional help if you can. It's difficult. There are obviously many obstacles in the way for autistic people to access the help they need. Often the help's not tailored to them. Often just even picking up the phone is a barrier for a lot of autistic people. However, I'm on medication and I find that helps. I also have a therapist who I've just started with, and I feel like that helps since being discharged from mental health services. In terms of things I implement myself, it's me having to kind of hold myself accountable to making sure I'm honest with the people around me. And I think that comes with having a good support network, which I recognise I'm very privileged to have. but that helps me massively. And I think I've been able to, through therapy, I've been able to kind of build that support network better, because I've been able to recognise kind of who's good for me and who's not, and that's helped me. At times when things have been bad, I've had a chart where I've kind of labelled what each day is, whether it's a good day or a bad day, and that helps me see that it's not always the case. Journaling I find really helpful, engaging with my special interests, taking time to just rewind and decompress, and reminding myself that just because it's been a bad day doesn't mean you're falling back into a pit of depression. But also when I do notice that I've had a kind of a week of feeling really low, I make sure I try and do something about it, because I know that the longer I leave it, the harder it is to get back out of that again.
Yeah, I completely agree. Like, one of the things that I do if I'm really struggling is try just taking each day one step at a time. So if I get up in the morning and I'm like, oh gosh, I can't do any of this, I'll be like, what do I need to do first? Okay, I just need to brush my teeth. And sometimes I find that when I'm really struggling, living in 10-minute increments is a really good way to move forward. Can I ask the same question of you, kind of advice on how to manage mental health specifically as an autistic person?
I think what you said about the kind of increments, I mean, at my lowest point, I did it in 10-second bursts. It was like, get out of bed, walk to the bathroom. And that's what I've now taken on to actually say, because I think for neurodivergent, autistic people, it's the imminent thing. You're not thinking too far ahead. So breaking down your day, I've suggested writing on the wall what they got to do, even down to things like make a to-do list. So you write that you've got to do that. Write what you're going to have for your lunch, how you're going to make it, what you're going to chop first. Literally break it down, because it stops the hugeness of what you're feeling, and it just makes you think about that, and it makes it feel manageable.
Yeah, I agree. I mean, as someone with like a real extreme sensitivity to medication, there have been times where I've been worse on account of the medications that I've been put on. And I also agree that the therapies need to be adapted, because I don't think just change the way you think or it'll be okay has reassured an autistic person ever. Like with my own children who have their own mental health struggles, my own autistic children, my husband, who's allistic, will come in with, but don't worry, it'll be okay, to, is the house going to burn down? And I'll come in with, statistically, the house is unlikely to burn down because this is the number of houses that generally burn down, and this is how often it happens, and this is why we've made ours safe, and like facts around why it is actually going to be okay. And so I think with CBT, that there has to be some adaptation so that it doesn't just feel like placating our brains with it'll be okay, right?
And I feel like as well, clinicians can be quite quick to, when you have someone presenting with anxiety, obviously they don't always look further, like you were saying earlier, Hannah, digging in and actually seeing the autism if the person is autistic. I had CBT when I was 13, so before I knew I was autistic. But a lot of the things that were making me anxious was kind of noises, loud places, friendships. I would go out, I would have panic attacks. But changing the way that I thought was not going to take away that anxiety. What was going to take away that anxiety was helping to make the environment stable for me, to be able to engage with it. What else was going to help me was having people understand me and my needs and everything. Having someone try and change the way that I thought and change my thought processes wasn't helpful.
That's so true. So I think it's about, isn't it? Firstly, it's about let's change the system. But with what we've got now, it's about making sure that you're working with people, clinicians, therapists, who actually are trained and experienced in working with neurodivergent people, and also looking to people like yourself in the neurodivergent community who've been through these experiences and have got stuff to offer in terms of solutions there as well. One of the things that's really challenging when you're autistic is dealing with the GP when you have got mental health issues and you need to go to them. Often they might say things like, well, that's just because of your autism, or they might be dismissive. Have you got any tips, like from the other side in a way, I guess, of how best to manage those difficulties?
So what I always tell people or suggest to people is one of the main things to do, if you know you're going to go to the GP, either for an autism diagnosis or for help with mental health once you've been diagnosed, is go armed with evidence. And that is just notes that you've made of triggers, of moments, because they can't deny if there's evidence. That, let's face it, GPs are medical-based, they're problem-solve based. Particularly people that have got good at masking and camouflaging, they'll probably come across quite well in that 5-10 minute appointment they get. Or they can't actually explain what they've been feeling, and then it's too rushed and they have to go. So I always say make lots of notes, fill in some screeners, even if you can get them online. Also, if there's somebody you trust who knows you very well, they either live with you, they're a good friend or family member, take them in with you as an advocate and an ally. That if you find you cannot speak, which happens quite a lot, can't get your words out, you're panicking, they can take the paper off you and they can read the words. And if you want, prior to going to the appointment, I suggest writing a script. Can always be very helpful of exactly what you're going to say.
Emily, have you got anything you'd like to add to that?
Yeah, I would say that it can be really hard to even pick up the phone and make a GP appointment. Some GP appointments, some GPs you have to call. I know my GP, I have to pick up the phone to make an appointment. And it can be really hard. And I've seen some GPs who, prior to my autism diagnosis, didn't think I was autistic. Post-autism diagnosis are still quite dismissive of it, don't necessarily believe it or don't incorporate kind of that knowledge into like my other mental health care and stuff. But I would always say is that you can always request to see another GP. I know that it can be exhausting, it can take a lot of kind of energy or spoons that you might not have, but if you can get someone to help you with that, then that could be a good route, because just because one GP tells you you're not autistic doesn't mean that you're not autistic. Just because one GP tells you that you need to do something a certain way and it doesn't work for you doesn't mean that there aren't other GPs out there who might be able to suggest something better. Unfortunately, we shouldn't have to fight the system at all, but it kind of ends up being our life, doesn't it? Fighting the system for so many different things. And at the end of the day, we deserve to get the right healthcare that we need. And if you can manage it, keep fighting until you can get that.
Absolutely, I completely agree. And I'd just like to add to that if you don't have someone in your life that you feel like you can ask for help with that, there are advocacy services for disabled people, or you could apply for a care assessment and have that as a need and hire a PA to help you with that. So if you're feeling isolated and like there is no one in your support network, there are groups that you can go to, and maybe we can supply some information around that as part of this content. So if you found this video helpful, please like the video, consider subscribing to the channel and check out the description box for more information.